moving along to the next presenter, Dr. Florence Dallo, School of Health Science, Auckland University. Thank you.
Thank you for the introduction, Maha. Good evening, everyone. It's so good to see you all. I just, as I go through this, I see that there are 70 people on this call, and I know you all come from different backgrounds, whether you're healthcare professionals, researchers, educators, business owners, clinicians. I encourage you to really take in what Madiha talked about and what you're going to see for the rest of the evening. It will in some way apply to the work that you do. So I'm going to focus on how the research in the Middle Eastern community has been evolving over time. Madiha set me up very well, so I don't have to repeat many of the things she said. And so I'll just dive in. Next slide, please. So Madiha talked about how the Middle Eastern community is identified as white. If you were to look at any of the 130 surveys that the federal government puts out, you will only find 2 where we can identify Middle Easterners. The US Census, and that's not even complete, and the National Health Interview Survey, because they ask about where a person was born, but that only gets us the immigrant groups. So many of us, I've been working on this for 25 years, have worked really, really hard to overcome these challenges. And I'm going to describe to you what we have done to overcome these challenges. So first, primary data. Next slide. And you can scroll through these. I don't know how many of these I have. So obviously, a pretty easy way to include the MENA category in your research or your patient population or wherever you work and whatever you do is to collect your own data, is to ask people, are you of MENA background? And if so, I'd like you to participate in my study. And these are just some of the many, many primary data collection efforts that are out there. Now, one of the challenges with primary data is it takes a lot of time. It's very expensive. It's not always representative. And it would only happen in states like Michigan, California, and other states where there's a large population. So it's not always the best way to go. And good luck getting money to collect primary data, because Madiha just said the federal government won't give you the money. So now you've got to find a way to fund it on your own, right? So that's a huge challenge. However, there are many researchers who have collected their own data. So this is definitely an option. Next slide. The second way is also something that Madiha mentioned, and that's the surname algorithm. I know they're not on camera, but Julie Ruderbush and Randall Seaton are from Wayne State University. I've been working with them. You can see their names on some of these publications. Wayne State University owns a surname list of approximately 10,000 names of Arab and Chaldean Americans. And this has been validated, replicated, it's reliable. And so we've taken that surname list and matched it to administrative databases. So for example, you'll see the first study up here was using Beaumont data. So we merged the surname list with Beaumont data, and we were able to identify the Middle Eastern category. And that allows us to obtain baseline information about mortality, about health conditions, and other things. And so this is one way that we can do this. Now, while the surname list is impressive, it's been useful, it's really a game changer. And how we can do things, we can't always use it in other states because it was conducted in Michigan and it really relied heavily on the Michigan population. And as we have, more and more generations of Middle Easterners in the US, we really need to be careful of how far we can, use this algorithm. But it's been used, I would say, for at least the past 20 years, and a good way to better understand the health of the MENA group. Next slide. So using that surname list, we were really interested in COVID-19 cases using state data. So if you ever went to get a COVID test, and if you didn't have an opportunity to check a Middle Eastern box, which you probably didn't, you either checked white or you didn't check the form they give you when you go get a COVID test. So let's say you go get a COVID test, it's positive, your result is sent to the state, and they identify you as a 50-year-old white female who tested positive for COVID. So what that does is it makes the rates of COVID cases look really, really low. So if you were to go to the state of Michigan website right now and look at their data, I think what they had on there is like 2% of Arab Americans tested positive for COVID. When we looked at it, and remember, this is state data. This is not asking people. This is not self-reported. This is not asking physicians. You can see these estimates are startling. So among Arab Americans in Michigan, 16.78% tested positive for COVID, higher than any other racial ethnic group. Now, interestingly, what happens is all of the attention, and I understand why, it was also a serious issue, was focused on Hispanics and Blacks in the news. When people talked about health disparities, it was the high rates of COVID cases, hospitalizations, deaths from COVID, and it was looking at Blacks and Whites and Hispanics and how those rates were higher for Hispanics and Blacks. Nowhere in that conversation were Arab Americans included. The next paper we're looking at is mortality. So we're currently analyzing data for mortality from COVID among the Middle Eastern group. Next slide. And then we wanted to also look at sex and age adjusted estimates or odds ratios, meaning we wanted to control for sex, we wanted to control for age to ensure that sex and age did not influence the odds ratios of COVID. And what you can see if you look at model 2, Arab Americans were 2.48 times more likely to have a positive COVID case compared to whites. And the odds ratio for Arab Americans is also higher when compared to Hispanics of 1.57, Blacks 1.33, and then for Asians, they were less likely to have COVID than non-Hispanic whites. Their estimate was under 1, it was 0.54. So, again, because we use state data, unfortunately, state data doesn't collect a lot of other demographic, socioeconomic status variables. And so that's why we only had sex and age in these data. Next slide. So then the other place, like I mentioned, where we can identify Arab Americans is using data from the US Census. And so while we're able to get a lot of demographic information and economic information, the US Census collects one variable about health, and that is disability. So they ask about mental health disabilities, vision, hearing, physical disability, and 2 more that I'm not recalling right now. So unfortunately, while you can use the US Census, if you're interested in health, you only have one variable that you can look at. So this is the really major limitation of the US Census. Next slide. And then the National Health Interview Survey is the other one that I mentioned that we've used to identify Middle Easterners. There's a question in there that asks people which region of the world they were born, and there are 12 options. One of them is the Middle East. Now, the nice thing about the National Health Interview Survey, it has hundreds of health variables. health insurance, health access. Unfortunately, the only group of MENA you can identify from this are immigrants, because it doesn't break it down to say, are you US born or non-US? And then if you're non-US born, or non-US born, were you born in the Middle East? So we can't get to MENA individuals born in the United States. We can't identify them. All right, next slide. So I kind of want to, I think this is, I'm getting close to the end, but I want to have you think about some of the things that have happened in these last, I don't know, 300 years or so, when we consider the first. So
I'm in work.
In 1790, we had the first US Census. And of course, MENA were not identified then. They hadn't started immigrating. In the 1880s, there was the first wave of immigration. Not until 1974. So about 100 years later, did anyone publish a peer-reviewed article on Arab Americans? And now it's taken another, what is that, 30, 50 years for an opportunity to have a MENA category in the American Community Survey. And so it's taken a really long time to get to where we are, but I know we will keep pushing and eventually, have this MENA category. So this is just a, diagrammatic slide to really put into context when Arabs started immigrating and where we are now. All right, next slide. All right, that's it. Thank you so much for your attention. I'm happy to answer any questions.